All right. Welcome, everybody. And today I have Dr. Neal Barnard, an author, clinical researcher, the founding president of Physicians Committee for Responsible Medicine and the Barnard Medical Center. And I'm really happy to have him join our winter conference and share information about all these things that can be really useful in various directions that have to do with nutrition, with diabetes, with COVID, with anything that is in that direction. So thank you.
Well, thank you very much for the opportunity to speak with you today. I'm very grateful. We're talking about important things. COVID is on everyone's mind, and diabetes plays a particularly dangerous role in COVID. So if it's okay, may I share my screen and we'll launch into something?
Yes.
Very good. Here goes. Okay. When the pandemic first emerged in China, it was very clear that this virus didn't affect everybody the same. When you looked at people who were in the hospital, those people who were underweight seemed to do pretty well. They might have needed to be in the hospital, but they didn't have severe disease, meaning they weren't likely to end up in the ICU. They didn't end up on a ventilator. They didn't die. People who were called normal weight, 19% of them had that problem. People who were overweight, 29%, and people who were obese, 39% had serious disease. So right away, we knew there was something about excess body fat that could turn COVID into a killer. Well, this wasn't just true in China. This was also true when, as you'll recall, the virus then spread. It ended up in Europe and in France. Researchers noticed, yes, when people were severely obese, if they came into the hospital with COVID-19, that was a person who was going to end up on a ventilator and they might never come off. So it was clear there was something going on. Well, what is it that's going on? It turns out that a fat cell is not just a bag of calories. It's a living, metabolizing cell. And if you could look at a fat cell under a powerful microscope, what you would see on the surface of the cell is something called an ACE2 receptor, angiotensin converting enzyme 2 receptor. Okay, this is a receptor on the surface of the cell. Think of it as sort of a dock that goes out into a river and boats arrive and attach to that dock. In this case, the boats are the virus that causes COVID-19. And they arrive, you inhale it, they end up in your bloodstream, they attach to that ACE2 receptor on the surface of the fat cell. They can then enter the fat cell where they can multiply. And if you have extra body fat, you're making extra welcome mats for the virus. And it gets worse. It turns out that your lungs, you know that COVID is a respiratory condition, of course. Your lungs have cells called lipofibroblasts. These are cells that have, you can think of them as little bits of fatty cells in the lungs, but they can convert to what are called myofibroblasts, and they end up changing the lung itself. You know, normally when you inhale, your lungs are very elastic. They can inhale, they can stretch, and they contract then when you exhale. But with lung fibrosis, they can't stretch anymore. They can't relax anymore. And the lung becomes almost a useless organ. And that's what happens with this COVID process. So having too much fat, whether it's in your body in general or these fat cells in the lungs, this can cause a real problem when a person catches COVID. Okay, this is a picture of it. The big yellow blob, that's a fat cell. And you see at the very top there, you see that sort of little Y-shaped structure at the top, that's the ACE2 receptor. That's where the virus attaches. Then it goes into the cell and multiplies. Trouble. If we've got too much body fat, if we wanted to get rid of body fat, now is the perfect time to do it. Okay, but it's not just body fat. Researchers in China noticed something else. If people did not have diabetes, but they caught COVID, their mortality was about 2.7%. If they caught COVID, but they had diabetes at the same time, 7.8% mortality. So having diabetes was bad. But it wasn't just a question of whether you had diabetes or not. If you had diabetes under poor control, meaning your blood sugar tended to be high, 11% mortality. If you had diabetes, but it was really well controlled, 1% mortality. Now, what was the difference between these two groups? The way we look at control in diabetes is with a measure of blood sugar control, blood glucose control, that we call A1C. And hemoglobin A1C is just an index of what your blood sugar control has been like for the preceding 3 months or so. And if a person has diabetes, I want it below about 7, and then I'm going to call it good control. So the poor control group, they averaged about 8.1%. The good control group, they were around 7.3%. It's not really great control. Here's the point that I'm making. The difference between 8.1% and 7.3% is really small. Let's say a person's in poor control of their diabetes, and they came in here to our clinic, and I put them on a low-fat, completely vegan diet, plant-based diet. If their A1C was 8.1 to start, it would be dropping to 7.3% or even or below for the vast majority of people that we would be treating. You can get from a dangerous situation to a good situation really rapidly. Okay, so we've been talking about diet and its contribution to obesity and to diabetes, which are conditions that can lead to COVID being a real problem. But let's not forget where COVID actually started. It started in the live animal market. In China, it was bats that naturally can harbor coronaviruses. They're put into the live animal market and they're mixed with other animal species. But these markets exist in the United States too. It's not so much bats, but it's chickens and ducks and geese and so forth that people feel a need to eat. And yes, they're in China. And when you have multiple species that the virus can pass through, it will change. In Asian countries, animals are often purchased alive and kept alive. Like these are live animals on the handlebars. Why? Because it's partly tradition. It's also partly a lack of refrigeration. People want to keep the animal alive until just about supper time because they don't have a place to refrigerate the carcass. Cheerful, isn't it? In the United States, of course, we have this industrialized production of animals, chickens, cows, pigs, and other animals too. And that causes a place where viruses can easily pass from one animal to another, and they can change as they do. So the coronavirus emerged in a market that was selling animals. And it may not be entirely coincidental that coronavirus is an anagram for. Yeah, you got it. All right. Let me go back a little bit. Researchers have been looking at viruses and how they change. And I want to walk back to 1918. You know, the Spanish flu, where millions upon millions of people worldwide were killed. This was a bird virus, we believe, according to the best evidence we have, probably in wild birds, maybe a wild duck. The duck has the virus. The duck happens to settle down with your domestic flock, and the virus can then pass to your birds, and then it can pass to the person who is out feeding the birds. And so you have a wild animals virus now arriving in people. Here's what happened. This virus was new to human beings. They had no immunity. It caused a massive influenza outbreak in 1918 that lasted really the better part of 2 years. Then people developed a certain amount of immunity to that virus, that H1N1 influenza virus. They sort of got used to it and were able to keep it from being quite so severe in subsequent years. But in 1957, something else happened. That same virus, if you look at the second panel, you see on the upper right there, there's that H1N1 human virus that came from 1918. We've been passing it around ever since, but it sort of got married to another virus, an H2N2 virus, came from another, say, wild bird. The two of them combined their genetic traits, and now through a process we call reassortment, you've got a whole new virus that you have no immunity to. And the 1957 Asian flu killed lots and lots of people because we got a new virus. And again, this all comes from having animals in our midst when we really should not be having them. 1968, Hong Kong flu, same thing. You look in the third panel, upper right, you see that H2N2 human virus. Sort of the green and red stripes. Now, right to the left with the H3 avian virus that's all yellow, that contributes its genetic material. You've got a new virus, and now you're going to have a whole bunch more people dead. So researchers have said for a long, long time, if you have a poultry farm, if you have a mink farm, if you have a farm with pigs in it, you've got lots of animals then interacting with the human caregivers, where you can have, or slaughterers as the case may be, and you can have the virus passing back and forth. As it does, the virus changes in two ways. It can become more pathogenic, meaning more deadly. It can also be more transmissible, because normally you don't pick up an animal virus. They die when you get them, but as they start going between species, they can become more transmissible to other species, including humans. So, okay. By the way, it's not just viruses, it's also bacteria. If you go to the store and pick up a chicken package is frozen, you thaw it out, and then a little bit of the water kind of dribbles onto your chicken counter, and you say, oh, that's just the chicken juice, and you wipe it up with your sponge. It might occur to you that chickens aren't fruit. They don't have juice. That water that just dribbled out is the cooling bath water that the chicken carcass was put in to cool the carcass down right after slaughter. And so it's mixed with feathers and feces and bacteria of many kinds, and particularly E. coli bacteria. E. coli bacteria have been isolated from urinary tract infections, of course, very common. 70 or 80% of urinary tract infections have the genetic blueprint of a chicken-borne E. coli virus. In other words, what we think is happening is that people eat so much chicken, they're eating it at restaurants and whatever, they're picking up the bacteria, they swallow them, and they go through your system, and it's just a little couple of inches from the anus to the urethra, and they can then colonize the bacteria, leading to a bacterial infection, a urinary tract infection. The point really here is animals carry infections that you don't want. Okay, so let's say we decide, all right, I get it. Coronavirus was caused by eating animals, and when you eat animals, you get diabetes and excess weight. It becomes a potential killer. True. Let's talk about weight loss and healthy ways to go about it. Our research team here did a weight loss trial in overweight women. They were all after the age of menopause. They had all done Atkins, South Beach, Nutrisystem, Jenny Craig, you name the diet, they had done it. They all felt stuck. And they all said, gee, my metabolism is, when I was a kid, I could eat anything and I wouldn't gain weight. But now, I'm 55, 60. I just look at food, I gain weight. What's that about? I got no metabolism anymore. Well, so what we did, we randomly assigned them to either a low-fat vegan diet or what I'm going to call a conventional diet. It was actually designed after the guidelines of the National Cholesterol Education Program, NCEP. It was what used to be considered a heart-healthy diet. Not so much red meat or chicken or fish, low-fat dairy, that kind of thing. That was the conventional diet. And we compared it to a vegan diet. And we did not limit calories. We did not ask people to exercise, and we did not give them food. They had to figure it out on their own. And so the vegan diet was fruits, grains, vegetables, legumes. And when I say legumes, I mean beans. Beans, peas, lentils, and also bean products like tempeh or tofu, plus vitamin B12, very important, that was supplemented for everyone. And I have to say our participants were aghast when they found out the foods that they could eat, because they all looked at blueberry pancakes and chunky vegetable chili and linguine, and they decided that they were going to gain a ton of weight from this vegan diet. Well, when we do research studies, what we always do is we get everybody together once a week to make sure that we're doing okay on the diet. And about week 3, one of the participants said to me, Dr. Barnard, I found a food, a treat that I can have on your low-fat vegan diet. I thought, uh-oh, wonder what this is. She unzipped her purse and she pulled out a pack of Twizzlers, and she said, yes, it's true. You know those things, Twizzlers, the red licorice, those little twisty things they sell at 7-Eleven. She said, look at the label. It's true. They are vegan. There's no animal products in them at all. It's just sugary, starchy, artificially colored junk. And she made sure that all the research participants knew that you can have all the Twizzlers you want on Dr. Barnard's diet. Well, actually, that's kind of not what we were thinking. But when you do research studies, you set your rules, and our rules were no animal products, keep the oils low. So I guess a lot of people started eating Twizzlers. But anyway, be that as it may, the women lost weight. They lost a lot of weight. On the vegan diet, they lost about almost 13 pounds in 14 weeks. On the control diet, they did well too, but they lost about 8 pounds. So advantage vegan. However, we tracked them for another year and then a year after that. And the people on the conventional diet, they didn't do so well. They ended up gaining back their weight. But the people on the vegan diet were skinnier at a year, but they were skinnier at 2 years than they were at 1 year. In other words, you're making a qualitative shift in what you eat, rather than just trying to starve yourself, rather than trying to just eat quantitatively less. You're making a qualitative shift. You're eating different foods. You're eating foods that have fiber, that have complex carbohydrates, that don't have the animal fat, and frankly, don't have a whole lot of any kind of fat, and you lose weight. Okay, so NIH decided that we ought to put this diet to the test for diabetes. Okay, now, remember, diabetes, COVID comes in, you got diabetes, we're talking trouble. So if I can get diabetes under better control, that's great. So here's what we did. This was our study back in 2003. A plant-based diet versus a conventional diabetes diet. And the conventional diet meant cut calories. You know what I'm talking about. A person has got diabetes, they go see the dietitian gives them a menu and says, well, normally you eat about 2,000 calories. This menu adds up to 1,500 and just eat this way. And the patient looks at the list and says, this is it, right? Yeah, exactly. Okay, I'll try it. And about 2 days later, the patient calls and says, and if I'm hungry, what else do I eat? And the answer is nothing, go to bed. And you're supposed to adhere to this until you reach your ideal weight, which is never. But anyway, okay, I don't mean to criticize it too much. This is what people have been using as diets for people with diabetes. Keep carbohydrates steady. Don't overdo it on carbohydrate. This is the conventional approach. And don't eat too much bad fat, saturated fat, trans fats. Okay, that's the conventional diet. The other group was a vegan diet. No animal products. Keep oils low and low glycemic index. You know what I mean? White bread is high glycemic index. It raises your blood sugar pretty quickly. Rye bread is a little bit lower glycemic index. Pumpernickel bread, even lower. A bean, if I eat just black beans, pinto beans, there's a lot of carbohydrate in there, but it digests very gradually. And so it releases sugars into the blood very slowly. That's like super low glycemic index. Okay, so the plant-based diet, no animal products, minimize oils, low GI foods are favored. Okay, to cut to the chase, we're back to hemoglobin A1C. Remember, we wanted below 7, right? Our people were not below 7 at the beginning. They were all hovering around 8. And the red line that you see here is the conventional diet group. And they did well. They dropped from about 7.9 to 7.5. Good, that's a good change. But now look at that blue line. That's the vegan group. They dropped by about 1.2 absolute percentage points, or a little bit more than that, 8.1 to 6.8. In the world of diabetes treatments, that is enormous. If you had an oral medication that could knock down your A1C like that, you should patent it instantly, because it's like the best medication ever made, but it's called asparagus. It's called, this is vegetables and fruits and whole grains and beans, just simple plant-based foods without a lot of hoo-ha in it. Okay, so other researchers have done similar diets and similar studies, and our team has done others. And this was a meta-analysis done in 2014, summarizing all the results of all the studies that have been done. And if you have not read a forest plot before, that middle vertical line, see there's 5 vertical lines, the middle one is 0. If you're to the left of that line, if the little black squares are to the left of the middle line, that means A1C got better. And as you can see, it got better in every study. It's very consistent. You bring in people, put them on a low-fat vegan diet. It's not like some of them get better and some of them get worse. It's extremely consistent. It's a terrific way to get your blood sugar down and lose weight along with it. Okay, so this is the diet: fruits, grains, legumes, vegetables. Add your vitamin B12. Okay, let me walk you through how this affects blood sugar. What I'm about to describe is something that not only do most people with diabetes, they have not heard this before, but their doctors haven't heard it either. And this is a source of eternal frustration to us physicians who are studying this, because we've known about the causes of insulin resistance for a long period of time, but it somehow hasn't quite filtered into general medical practice. So let me explain it to you just real quick. This is a muscle cell, this big purple oval. It's in your arm or in your thigh or somewhere, and that muscle cell runs on glucose, sugar, simple sugar. That's its fuel, and it only works though if that glucose can get inside the cell. It's like gasoline works when it gets into your engine. If it doesn't get in there, nothing happens. So the problem is that muscle cells have a membrane that does not let the glucose in. It just bounces right up. Okay, the body is regulating the sugar. It will not let it in until you have a receptor and a key. Now that key is called insulin. And if you can't see this on the right-hand side of your screen, if my little photo strip is getting in your way, you can just minimize that so you can see. But insulin is a hormone made in your pancreas, and it goes in the blood, and it arrives at the surface of the cell and attaches to a receptor. It's like a key goes in a lock. Insulin attaches to a receptor, and once it does, some magical things happen. That insulin receptor combination triggers the opening of a little channel on the cell, and now look, glucose can come in. Hooray! Okay, that's what does it. You don't have insulin, you can't get the sugar inside. Okay, so what could go wrong? What goes wrong is this. That's my dinner. That's my lunch. That's my breakfast. And I'm eating all this fatty stuff. Yes, these things have a lot of fat in them. And they vary in whether it's a really bad fat like pork fat or a somewhat healthier fat like olive oil, but it's all fat. And what happens when I eat that? The fat goes into my muscle cells and my liver cells and my fat cells too. And when the fat builds up, this is what counts. When the fat builds up inside the cell, the insulin key no longer works. We call it intramyocellular lipid. It's fat inside a muscle cell. So the key says, all right, let's open it up. Come on, let's get the sugar inside. But nothing happens. This is insulin resistance. The key does not work. The glucose stays outside and your blood sugar rises. And now anything you eat an apple, your blood sugar rises. You eat some bread, your blood sugar rises. Have some rice, have some organic brown rice, your blood sugar still rises, right? Because you can't get the sugar inside your cell. What do? Let's say I go into Dr. Barnard's clinic and we say, all right, plant-based diet, there's no animal fat in it anymore. And we're going to keep all the oils pretty low, and something remarkable happens. The fat in your cells starts to dissipate. You're not eating fat anymore, or not very much, and it goes away. And when that does, your insulin resistance goes away too, or it improves, it reduces. And now that insulin key can open up those channels, and now the glucose can come back in. You're turning the diabetes process around. Hooray! So everybody's happy. So that's why the hemoglobin A1Cs in our participants, they just go right down because you're getting the fat out of their cell. Cool, isn't it? All right. So let me take you to New Haven, Connecticut. And I want to show you a study that Kit Peterson and Jerry Schulman did. They brought in 26 young, skinny, healthy people who didn't have diabetes. And they gave them a glucose tolerance test. If you never had one of these, what you do is they give you a little cup that's got 75 grams of sugary goo in it. It's like syrup. You drink it down and your blood sugar is going to go up. And in some cases, you're going to be insulin sensitive. That means your blood sugar will go up, but it'll come right back down because your insulin will get it into your muscle cells, into your liver cells. Great. But some people are insulin resistant. That means they drink the sugary stuff and their blood sugar goes up and it won't come down because their cells won't accept it. Okay. So then let's look at who these people are. Young. They're in the 20s. The people on the left are what I'm going to call the normal group, the insulin sensitive group, 28 years old on average. The insulin resistant group, 26. Okay. Young, skinny people, 132 pounds, 141 pounds. And those A1Cs are normal. They don't have diabetes. However, now I'm going to put them in a scanner. Magnetic resonance spectroscopy. That's what it looks like. That's a big donut-shaped magnet. And they go inside, and I'm going to look into their muscles. And I want to show you what I found. These, on the left-hand side of this graph, every dot is a person. Every dot is a person. And these are the control subjects, the ones who were healthy, the ones who were not insulin resistant. And what I'm looking at is intramyocellular lipid, the fat inside their muscle cells. These are the people who are insulin resistant. Okay, remember, these are young, thin people who don't have diabetes. But the fat is building up inside their muscles. You with me? That intramyocellular lipid is higher in them. And now look on the right-hand side. These are mitochondria. You remember from your high school biology, your cells have mitochondria. Those are your burners. They're inside your cell. They're giving you energy. And every dot is a person. This is their mitochondrial activity in the normal participants and now in the people who are insulin resistant. What am I seeing? Despite the fact that they're young, thin, so far as they know, they're totally healthy. They don't have diabetes. Already at that age, in their 20s, some of them have the buildup of fat inside their muscle cells that's causing them to be insulin resistant. It's shutting down their mitochondria so they can't make energy anymore. They're going to be starting to gain weight, not now, but 7, 8 years from now. They're going to get diabetes, not now, 10 years, 12 years, 15 years from now. We can see with a scanner these processes beginning in these research participants who had no idea that this was happening to them. Okay, early December 2020, our research group published a study, Dr. Hanna Kaliova and I, along with Dr. Tip Peterson and Jerry Schulman at Yale. And here's what we did. We brought in people who didn't have diabetes, they just had extra weight, 244 of them. They came into our center here, and half of them went on the healthy plant-based low-fat diet. And let me show you what happened. Okay, so half of them went vegan, half of them stayed on a control group, and for 16 weeks, they followed their respective plan. The control group, nothing. The vegan group, vegan, low-fat, okay? And then we looked at their change in body weight, and this is no big shock. The vegans lost weight over 16 weeks, about 14 pounds, 6.4 kilograms. Pretty good. Okay, fair enough. The controls, not much happened. And why? Well, they were eating more fiber. Fiber fills you up and it doesn't have much calories. And because they're eating less fat and more carbohydrate, fat has 9 calories per gram. Carbohydrate has only 4. You know, so many of our research participants, they came in, they were afraid of rice. They said, oh my goodness, so much carbohydrate, I'm going to gain a ton of weight. You have to say, okay, memorize this, please. Carbohydrate has 4 calories per gram. Fat has 9. Your rice is not going to make you heavy, I promise you. But, well, anyway, you get it. Okay, so then we looked at their insulin resistance, the thing that I was describing earlier that the young people who are not diabetes already had. The people in our research study that I'm describing now didn't have diabetes either. But they were overweight, and some of them had some insulin resistance, and being on this vegan diet for just 16 weeks made their insulin resistance fall. Okay, that's pretty good. All right, but then we went a step further. We measured their metabolism, and we do it with a technique that you're seeing described here. It's called indirect calorimetry. The patient participant arrives, they lie down on a table, and you put this plastic shell over their face. And what you're doing is you're capturing their carbon dioxide output and you're measuring their oxygen intake. Because if you're burning calories really slowly, you don't make much carbon dioxide. If you're burning calories really fast, You're taking in a lot of oxygen, you're putting out a lot of carbon dioxide, okay? So we can measure that, it's real easy to measure. And what we found is 6 o'clock in the morning, everybody arrives, they're in their pajamas, they lie down on the exam table, you put the plastic thing over their head, and then you measure their metabolism, and it's low. It's the left-hand side here. Their metabolism very slow. Give them breakfast. And now their metabolism rises because you're absorbing nutrients. Okay, now everybody goes vegan. Plant-based, low-fat, healthy. Bring them back to the laboratory. 6 o'clock in the morning, measure their metabolism, it's slow, give them breakfast, and something happens. Wait a minute, their metabolism is rising, but it's rising more than it was before. Not a lot, maybe 15%, something like that. But the point is, why do people who follow plant-based diets, why do they tend to be slimmer? Partly because they're eating more fiber, they're getting fewer calories, they just are filling up before they overdo it, but it's more than that. Their body is physically changing. Their metabolism is actually higher after every meal, after breakfast, after lunch, after dinner, for about 3 hours or something like that. Okay, so we call this the thermic effect of food. Your body is taking energy and giving it off as body heat instead of storing it as fat. So let me say that again. Let's say you take in some oatmeal. Are you going to store all that as fat? So like every bite of oatmeal, you're going to store it as body fat? Well, hopefully you're using it for energy, and then it actually goes away as body heat. All right, this is the control group. No diet change. Week 0, baseline, that's white. They ate their meal and their thermic effect of food went up. You know, they burn calories faster after the meal. Week 16, gave them the same meal. They hadn't done any diet change. Their thermic effect of food looks exactly the same. They're eating the meal, they're giving us some calories, but no big changes are happening. So this is the vegan group, and I don't know if you can see this, but right about the white line again is their change in calorie burn right after a meal as the 30 minutes, 60 minutes, 120 minutes, 180 minutes go by. Then 16 weeks after going vegan, what you discover is they're burning calories faster, but notice how those two lines start splitting. After about an hour, 2 hours, 3 hours, they're burning calories substantially faster than they were before. In this study, about 14% faster. In a previous study, about 16% faster. Okay, so why are vegans skinny? Because they burn calories more like a 16-year-old. Okay, so, all right, now we're back. This is the MR spectroscopy scanner, and we actually looked at their liver fat. Not muscles now, we're now looking at their liver. Yes, people went vegan here in Washington, D.C. We put them on the Amtrak train. They went up to New Haven, and Kit Peterson stuck them in the scanner, and we looked inside their liver. And when people were on the controlled diet, nothing happened. Or if anything, they got a little worse over 16 weeks. But on the plant-based diet, on the vegan diet, their liver fat dropped by about a third, about 34%, meaning you're giving up a third of the fat stored in your liver, which is a good thing. You don't want to keep that. Okay, so in summary, this study, which was just published in JAMA Network Open in early December of this year, 16 weeks on a low-fat vegan diet, average weight loss, 14 pounds. We'll take it. Better insulin sensitivity, better metabolism, reduced liver fat, what's not to like. And in a year where COVID is finding people with diabetes, finding people with extra weight, looking for people who are insulin resistant, this is a self-preservation way to go. Okay, now, in case that wasn't enough, I just want to go over a few more details. I said that somehow the people on the regular diet had a slow metabolism. The people who got the fat out of their diet increased their metabolism. I just want to walk you through this real quickly. Okay, so this is that same muscle cell. That's a mitochondria. Those are 2 mitochondria. There's a whole bunch of mitochondria. Those are burners, and there's all that darn fat. For lunch, I'm going to have a bologna sandwich with extra cheese and mayo. And what happens? Within about 30 minutes, the fat in those foods gets into the blood, starts packing into the muscle cells, and you can measure. There it is. And the mitochondria get intimidated. They stop producing energy for you. So fat in the cells slows down your after meal calorie burn. What do? Get the animal fat out of your diet, keep the oils pretty low too, and the fat goes away. And now your mitochondria say, great, okay, wonderful. I'll give you some energy now. Thanks for getting rid of all that fat. Getting the fat out of your cells boosts your after meal calorie burn. Not rocket science, very simple. The only problem is nobody knows this. They're going on an Atkins diet or South Beach or all these other things, when instead go on a plant-based diet and your body is functioning more like it was when you were a teenager. Okay, that's the idea. All right, let me just shift gears to a couple of other things before we end. Obesity and diabetes are not the only concerns that we have when COVID is around. Hypertension is another one. High blood pressure. And if your blood pressure is lower, you're going to do better if COVID comes knocking. So what do you do about high blood pressure? Well, you'll hear people say to reduce salt, and that's a reasonable thing because salt will hold some water in your bloodstream. However, we can go further. When you substitute for the animal products you might have been eating, if you substitute plant products, they have very little sodium naturally, and they have a lot of potassium that lowers your blood pressure. That's good. Now, if you look at how much sodium is in plants, look at that, very little. And a whole orange has 1 milligram of sodium, an apple has 2, brown rice 20, a potato 13. Wait a minute. Let me take that potato and cut it up and throw it in the fryer. And it comes out as potato chips. And you put, potato chips aren't potato chips unless you cover them with salt. And so now it's got a typical bag of potato chips, 330 milligrams. Yes, I'm not making this up. 330 milligrams of sodium in 2 ounces. Ugh. Okay, if that isn't depressing enough, cheddar cheese. That's right. In the cheese manufacturing process, salt is used to control the bacterial fermentation, and they use a lot. 2 ounces of cheddar have more sodium than 2 ounces of potato chips. And if it's Edam, it's 500. And if it's Velveeta, it's 800, yes, 800 milligrams of sodium in 2 ounces. All right, don't eat that. If it were any worse, it would be Vaseline. Okay, so all this grease, the grease in meat, the grease in cheese, the grease in fried stuff, adds to the effect of the sodium on your blood pressure. Picture this, your heart has to push your blood up the carotid arteries to your brain. It's got to push the blood down to your legs. If your blood has low viscosity, if it's thin, if it's more like water, it's easy to push. You don't need a whole lot of blood pressure to get it up to your brain if you have healthy, low viscosity blood. But if let's say I had a cheeseburger for lunch, the grease in there makes my blood too viscous, too thick, too much like grease, and it's not like water anymore. Imagine how much your heart is going to have to push to get grease up to your brain. Okay, so meaty diets increase blood viscosity. That increases your blood pressure too. So back in 1997, the DASH study began, and it instantly became a classic, because what researchers did is they took 8 weeks to lower your blood pressure. It was an 8-week study, very short study. They wanted to see if they could lower blood pressure, and they did it just with diet changes. That's all they did. They brought in a large group of people, 459. And they said, let's do 2 things. More vegetables and fruits. Let's reduce the meat. Let's reduce the fat. And I want to show you what they did. On the right-hand side here, you see three curves. But the top one is people who didn't do anything. It's the control diet. They didn't make any diet changes. And their blood pressure is sort of not much happened. The line right under that, those are people who started eating vegetables and fruits. High in potassium, my blood pressure is going to come down. Okay, that's good, and it does. But the line below that, those are people who ate their vegetables and fruits and reduced the meat and reduced the fat. And their blood pressure dropped really quick. Now, this is systolic blood pressure. That's the top number. If your blood pressure is 120 over 80, that 120 is systolic. That's your pressure when the heart is beating. Diastolic is the 80. So with every heartbeat, as the heart squeezes, it goes up to 120, and then it relaxes, it goes down to 80. your pressure goes up to 120, down to 80. Boom, 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 boom. Okay, so this is diastolic. Same story. If I get the meat out of my diet, get the fat out of my diet, and have lots of vegetables and fruits, I got the best of all possible worlds. My systolic goes down, my diastolic goes down, everything gets much, much better. The thing I want to emphasize, though, is when did this occur? This was an 8-week study. But look, you got the benefit in 14 days of this. All right, how many people do you think are going to get infected with COVID-19 after the next 2 weeks? You know, next month after, a lot of them. If they follow only this advice, get the meat down, get the fat down, increase the fruits and vegetables, eat plant-based foods, their blood pressure would come down within about 14 days. That's not all you want to do. You want to take care of yourself in every way. But the point is that diet changes are powerful and they are fast and they are comprehensive because they affect your weight, they affect your blood sugar, they affect your cholesterol, they affect your blood pressure, they affect all of these things simultaneously. Okay, so people come into our clinic and they say, Doc, I need to fix my diet. I'm terrible. I'm having trouble losing weight. What do I do? And we explain what a plant-based diet is. And we recognize that that may sound like a real heavy lift for people. But we have a certain way that we introduce this. And I want to share it with you because I've never seen anyone unable to do it. After explaining what I've just shared with you about how the diet can affect their weight or their cholesterol or their blood sugar or whatever, we then say, okay, if you want to give it a try, check out the possibilities. For the next 7 days, just look at what you would like to eat that's vegan, that has no animal products in it. And we give them a piece of paper and say, fill it out. Take this paper home, come back next week. And I want to see breakfasts and lunches and dinners and snacks that you actually like. Try them out. They got to have no animal products, keep the oils really low. And you give them some suggestions. Okay, so I could have, some pancakes or some oatmeal or whatever. I can scramble tofu instead of scrambled eggs. Okay, that sounds fine. And you say to the patient, if you don't like scrambled tofu, don't write it down. But if you like it, write it down. And then go on to lunch and you're going to try different things. I can have a veggie wrap or a salad or beans and rice or whatever. Try it. If you like it, write it down. And then the patient discovers, wait a minute, this sometimes works at a restaurant. I can go to an Indian place or maybe even an Italian place, maybe Latin American, easy. They got lots of things. And Chinese, like 3 dozen things on the menu, or tofu dishes, vegetable dishes, rice dishes. Extra points for Japanese. Edamame, veggies, skip the fish sushi. But the cucumber roll, the asparagus roll, the sweet potato roll, the seaweed salads, the miso soup, you're in heaven. It's not only vegan, but it's also really low in fat too. Fast food, not the pinnacle of culinary art, but if that's where you are, see what you find. Okay, so the patient comes back. It's been a week. Doc, I found all kinds of great things. Here's my list. Okay, now step 2. Step 2 is to eat those foods for 3 weeks. So what the patient will now do is they're going to be 100% vegan, but that's easy because they already picked out the foods and it's only a 3-week test. At the end of 3 weeks, they will say 2 things. Number 1, physically they feel different. They're losing weight, their blood sugar is getting better, they're probably dropping their insulin doses already. Physically they're changing. But the other thing is that their whole attitude about food is different. They thought they couldn't live without a chicken leg, but they realize they don't really miss that. And they're discovering there are new foods and new recipes and new tastes, new products at the store. I never knew I liked seaweed. Wow, isn't that really cool? And then they discover that so many of their friends are going in the same direction. And their attitude just changes so much. This doesn't happen if the person is encouraged to just make tiny little changes. Just have a healthy meal once in a while. No, they're not going to really get enough change to be rewarded. Jump in, but for a short period of time. After 3 weeks, the person says, I'm going to stick with this because they really like how they feel. Let me just stop at that point, but I want to just share one last thought. And that is, I hope you've enjoyed this, but the people who need this message the most are people who are not yet hearing about any of this And so we need to spread this message to everybody we can, make some noise, and especially for children, because children today are growing up with far less than healthy diets. And if we make a little noise and get this life-saving message out, it can really change lives all over the world. That's our job. Thank you very much.
Thank you. That was absolutely fabulous and very, very enlightening because, well, it can make, like you say, in 2 weeks, you can have a huge difference already. And if that can help to prevent people from really getting sick or potentially even dying, then this is fabulous.
It's a very powerful way to go, and everybody gets their own benefit. Some more than others, some faster than others. But I say let's jump in, put it to work, and see what happens.
I have one question.
Mhm.
You were talking about, how the energy, metabolism rises
Yeah.
when you're eating that way. Does that also mean, like, when people have this falling asleep after a meal, really feeling tired, is that will that go away with the raising of the metabolism?
It does improve with the plant-based diet, and the mechanism, I believe, is really because your diet is so low in saturated fat. That's the fat that's abundant in, say, bacon grease, where that's the fat that's really, really viscous, really thick. Because your diet has almost none of that in it, your blood flows very, very easily after a meal, and so you stay awake. Um, so after a typical Thanksgiving meal where the person has had not just the turkey, but the gravy and the pie with, it's 3/4 butter, their blood viscosity goes up so much that their blood is now kind of like lard going through their veins. And so they just aren't oxygenating their brain very well anymore. I think that's really what's happening. And
Ah,
in fact, I got to tell you, researchers have looked at what happens cognitively after that kind of meal, and it not only does it make you tired, it impairs cognitive function as well temporarily.
that makes complete sense. Makes complete sense. Well, thank you. And this was absolutely fabulous. And we will share that. And yeah, that is a message we definitely want to make people aware of. And
So,
I will stop.
thank you very much. I really, really appreciate your inclusion.